First, me introduce Dr. Kornkit Chaijenkij. He is a lecturer from College of Sports Science and Technology, Mahidol University. He's going to talk about road to efficient recovery after surgeries. Please.
Thank you, Chairman and Co-Chairman, and thank you all the speaker and also the TOSSM committee. My name is Kornkit. I come from College of Sports Science and Technology, Mahidol University. This is the picture yesterday. Right now, I work for the College of Sports Science and Technology. And also, I work along with the Sport Authority of Thailand and Taekwondo Association. At first, I think right now, most of us in TOSSM, we talk a lot and we did very well for the structural injury. And when we know about that, I think the main thing is that, I think the main is that it's in the function, because when we talk about the athlete, I think everyone know that they have to move, they have to go to play, and that's why I think our strategy right now we do very well for the structural, but I think we have to ask ourselves about the function, that our patient that after injury that can they return to play or not. I think this is the main thing that I think is quite important. And that's why I think for us, we have to set the goal to make them happy to come back to play. That's why this talk for today. So I think right now, when we talk about how we can return them back after surgery or after injury, I think right now from the evidence base, they show a lot. We can divide into three things, mostly of the literature and mostly of the practitioner. The first thing is that it's about the strength and motion. On the second is about the neuromotor control. And the last one is about how they move when they come back to play. So for me, I think if you can define in each one, I think for us, we have to know how much that our patient can coming back to move or range of motion, and also for the patellar mobility. And we have to gain the quadriceps strength, and also for the hip that the previous speaker already mentioned is quite important. And in the meanwhile, we have to improve the hamstring also. And on the second, we have to let them improve their neuromotor control and about the hip joint and also for the ankle. And the last one, we have to define about how can we move to the sport-specific movement and technique, how can they prevent the injury like the landing and also for the running and the cuttings. In this one, this is my currently work. I and my student, we ask ourselves that right now, what is the evidence base that can show us how we can return them to play by the reconditioning? From the unpublished data right now, we found that they have in the green color, on the dark green, it means they have a lot of evidence. On the light green, it means they have some. And the yellow one is mean the quite few study. And also for the white one, it mean the gap of knowledge. From this unpublished data in systematic review, we found that they have a lot of innovation and technology to help them to come back after surgery, after to play. I will show you next in the slide. So I think in my idea and from the evidence base, from our unpublished data, they have three things that we have to concern after surgery. The first one, right now, the but-for restriction or the special kind of tools that they use like our tourniquet in the operating theaters to occlude your blood pressure and make your muscles or your brain think it's quite hard load or high load. They can improve your patient for the quadriceps strength and also for the strength of and the size of the muscles. On the second one, we can, from the evidence base, we can show that if you can combine the exercise strength as soon as possible, in between, you have to communicate between doctor, PT, and also the sports side. It will increase your patient for the functional score and for the strength and for the power also. And the last one, recently on the 3 to 5 year, we talk much about the neuromuscular training. Right now, they have a lot of technology that they can help us Example, you can use the electrical stimulation to use it in between you train the athletes. And also right now about the visual training, like, try to distract your visual training between the train. It's going to be one of the trends that they can improve your patient result. In this kind of thing, you can talk with your sports scientist or athletic trainer to help your patient while they're training. This one is my currently study in unpublished data, and I and my student will ask about how about but for restriction for the aerobic conditioning and also for the performance. We found that if we use the low load with the but for restriction in the athlete or in the patient who cannot do the moderate or high load, we found that it makes your patient or your athlete have a good aerobic compliance, aerobic capacity, and also for the time trial for the rowing athletes. So it means that if you have the patient who undergone surgery, rehabilitation, maybe BFR is one of the options, and also in the early phase of the after surgery, they can improve the aerobic capacity and in the meanwhile in the time trial for the sport. So that's why I think for us, for the doctor, physiotherapist, and the sports side, how can we let them come back to play? I think we have to coming back, sit together and talk about what should we measure and what should we do. In literature and a lot they talk about we have to conclude that what patient report outcome should we use. And also right now we have a lot of technology that they can quantify and qualify the size of the muscles, or maybe ultrasound, maybe we can use that to help us. And also, because of the muscle strain, they have so many things. I think we have to conclude for us what should we do. Maybe isokinetic, maybe by dynamometer, or maybe just use the manual. I think this is the one that we have to concentrate together. For me, I think right now the measurable outcome of the quality of movement or neuromuscular control, they have a lot of things like rate score, single leg squat, balance test. I think every test have evidence. It depends on us what should we should communicate and conclude with the team. From the video, we can show you something that eventually for the high level athletes, they still have some movement quality that we can collect is better. It means that if you have a high performance, it doesn't mean you have a good move. So we have to think about that. And the same, in the recreational sport, they have a lot of bad quality movements. So it will make them easy to injury and also for make them have not good performance. In this video, I love a lot because of, I think CR7 is quite one of the people who's conditioned very well. Most of the time, the good player, they can move differently from normal training that we do in the gym. So that's why I think we have to find out what is the measurement that we can use the specific sport. In this video, they can show very good for one leg landing in very high jumping. In the meantime, I think right now we need to monitor them also. Most of the time when the physiotherapist or athletic trainer or sports scientist, they do the training, they do the monitor very well. But right now, I think we need to find some solution that it make more better. Right now, a lot of study, we do monitor the overuse injury or overtraining in questionnaire in every week, and we can quantify to make them to beware of the overuse injury. In the meantime, they can do the training load monitoring also. So you can discuss with your PT or personal trainer. And right now, I think in my experience and also a lot of study in the last 5 years, we found that a lot of training from the physiotherapist or a lot of from sports scientists, it's not to show well result because they have not good compliance or adherence. Most of the study that show that if you can increase your compliance of the patient who can train more than 80%, it will improve your patient results. In my practice right now, I try to make monitoring them with something like like some measurable outcome to see the motion by the application and also by the line that maybe everyone can use, or maybe by the social network that we can use to monitor them by our team. I think is the key. So in this slide, we show that you have to ask yourself that when you teach the patient or athlete to training, how much they can train, how quality they can train, and how continue they can do it. I think is the key of the recovery of the patient or athletes. So in the conclusion, I think right now from the evidence base, they show that we will have some innovation or technology like but for restriction. Maybe you have to rethink about your protocol with your team, and maybe you relearning or re-educate your team. On the second, I mean, the eccentric training is one of benefit of the training in the patient or in the athlete after surgery, but you have to communicate very well because we have eccentric early, maybe we can make more injury risk. The third one is about you think about neuromuscular training in the training session after surgery. And the last one is about the movement pattern that is specific to the sport that they involve. So if you interest that tomorrow from 11 to 12 in room 3, we will have a workshop with Professor Hirose and me and Ajahn Virewat, who are the biomechanists. And also we have Dr. Chanin to come to make a movement assessment, and we try to correct them in the workshop. So if you feel free, you can join. If you want to try that, maybe you can use the casual sport wear to test what we do in tomorrow in room house C. So my take home message is that if you're going back from this room, I think you have to think about your protocol after surgery, to think about neuromuscular training. You have to talk with your team, with the measurable outcome that we go together with doctor, PT, and sports scientists. And the last one, you just don't make them do by their own. Don't make them alone. You have to monitor them by the method that we recommend before. This is my talk. Thank you.
Thank you for wonderful presentation.